for doctors is that we're so busy and we have such a small window for each patient we see throughout the day that we don't have time to explore refractive options adequately. And to understand a patient and have that conversation in a way that we seek first to understand, we need to ask a lot of questions. MD Backline automates that. And so it presents to the doctor a visual profile report that includes a whole lot of information about the patient's complaints, but also a summarized and validated likelihood that the patient will choose a refractive upgrade of some type. And there's a whole lot that guides that, and it's validated based on hundreds of previous patients. So what we find is that far more patients than we might guess are interested in seeing without glasses for the rest of their lives, if possible. Far more patients are willing to pay something for that. And so it really becomes a question of, okay, what's the right technology for them? And the visual profile report guides you right toward that using all the best practices, from experienced surgeons. And then what can you afford, which is easily handed off to office staff if necessary. What we've seen is not only do patients end up happier because they understand their options, but practices have a lot more adoption of premium lenses. It's typically in the range of anywhere from if you're a practice that has 30% conversion rate, it might go up to 40. But if you're a practice that's got a 10% conversion rate, it might go up to 25. And so everybody wins when patients get what they want and when doctors operate at the top of their game, which is, of course, what refractive cataract surgery is.
Well, what you've done is you've taken a process that was a manual, labor-intensive process that had to be done in a very short window of time, and you've removed time as the element. You've allowed also the greater convenience. The patient can do it on their time, right? They can get more and more comfortable based on their own needs. And then that precious few minutes that they're with the doctor can be spent on higher level discussion.